Hi, I'm Ruth O'Regan. I'm the Chair of Medicine at University of Rochester. Alpelisib is a PI3 kinase inhibitor that was recently approved for metastatic hormone receptor positive breast cancer that has a PI3 kinase mutation. So over the past several years, we have been doing genomics on patients with HER2 positive metastatic breast cancer. And really until we had alpelisib, it wasn't clear what we should do with that information. So about 40% of estrogen receptor positive breast cancers have PI3 kinase mutations. So that's the group of patients that would likely benefit from alpelisib. So what was shown in the SOLAR-1 study was that the addition of alpelisib to fulvestrant compared to fulvestrant alone quite dramatically improved progression-free survival in patients who had been treated in the second-line setting for hormone receptor positive metastatic breast cancer. More recently, the BILEAV trial looked specifically in patients who had both endocrine therapy and CDK inhibitors and first-line therapy for hormone receptor positive metastatic breast cancer, and also showed clear efficacy for alpelisib in combination with fulvestrant. Now, alpelisib does have some toxicities. The one that perhaps is most notable is that it causes hyperglycemia. So before a patient starts alpelisib, it's important to certainly check their fasting blood glucose and also their hemoglobin A1C. And then it's recommended to monitor these blood tests through the first cycle and then every cycle until they're stable on their dosing. Now, it can be used in diabetics, but it's important to be very prudent about testing blood sugars and hemoglobin A1C in those patients. If they do develop hyperglycemia, obviously diabetic medications such as metformin can be used effectively in these patients. And within the package insert, there are guidelines on what to do if there is hyperglycemia in your patients. So that's probably the side effect that is most problematic for patients, and it is something that's seen with these class of drugs, these PI3 kinase inhibitors. Other things that can happen is patients can get rashes. There's been a number of different types of rashes associated with alpelisib, but what has been shown is that if you pre-medicate with an antihistamine, that actually decreases the risk of rashes in these patients. Other things that can be seen are GI toxicities. So nausea, diarrhea is not uncommon with this agent, but generally we would recommend just to treat those supportively. So what should you do for a patient that you're starting on alpelisib? Well, the first thing, of course, is to make sure that they're a candidate for the drug by doing genomics either on the tumor or in the blood, and to see if the patient has a PI3 kinase inhibitor. If they do, and if they've already received first-line endocrine therapy for hormone receptor positive metastatic breast cancer, then they're a candidate for alpelisib. One of the problems I think we run into as clinicians, though, is that it is currently approved only with fulvestrant. So if you've used fulvestrant in the first-line setting, it's not really clear, what we should do in the second-line setting, because we don't have data right now suggesting that if you continue the fulvestrant and start the alpelisib, that's an effective measure. So then, as I mentioned, checking the blood sugars, hemoglobin A1C, and then once you're ready to start the medication, considering putting the patient on antihistamine to help with the rash is recommended.